Greetings, my IDD subscribers. Is my lower back pain due to internal disc disruption or discogenic lower back pain? If you have watched my videos or read my paper, you will know that 40% of all lower back pain is due to internal disc disruption, also known as discogenic lower back pain. You will also know that if you are between the ages of 20 and 45 and you have lower back pain, the probability is above 70% that the cause is internal disc disruption. Still, the only accepted diagnosis for this condition is the controversial provocative discography. So let's look at the anatomy again. Between the vertebra, between the bones, is a disc. The disc acts like a shock absorber or a spacer to allow movement. So if you had to cut the disc in half, if you had to cut that disc down the middle, it would look something like that. There would be a nucleus in the inside with annular rings and the sinuvertebral nerve on the outside. And the nerve innervates the inner third of the disc. So due to excessive loading, twisting, lifting, genetics, this disc might slowly get injured inside the disc. Instead of looking like that, it makes a little tear in the disc like that. And that little tear starts to get closer to the sinuvertebral nerve. So with compression, that little fissure irritates the nerve, causing mechanical and chemical pain, which is agonizing, burning, and debilitating. This irritation, this nerve irritation, can cause pain in the quadriceps, in the hips, in the groin, in the lower back, and it might even make one feel weak in the legs. So I'm going to try and explain moderate IDD, the signs and symptoms of moderate IDD based on my experience. So the patient getting up struggles to get up, because as they get up, they are changing pressure on the disc. And eventually they might stand leaning forward slightly. Walking is challenging because as they walk, it squeezes the disc, so they walk like they're walking on eggs. If they cough, the disc does that. They might have pain with that. Leaning to a side, especially the sore side, forwards, backwards, that pushes that little fissure towards the nerve, towards that sinuvertebral nerve, giving you that agonizing pain. With leaning on something, there might be a feeling of comfort, and actually the bending might be slightly better or slightly easier, because you're taking pressure off the disc when you lean. When the patient coughs or sneezes, so when they cough without leaning, it does this, and when they lean, it does less of that. So cough might be relieved a bit by leaning. So positions that might be uncomfortable is lying flat on your legs, flat on your back like this. This is probably uncomfortable. Lying like this is more comfortable. And lying with something underneath, so while you're lying flat on your back, it was doing this, and as we bring the legs up to this position, it takes pressure off. That's why these last two positions are more comfortable. Often people lie on their side with a pillow between the knees, they've just learned to do this because this opens the back and is just relieving. There are two typical positions that cause relief. And one is pulling the knees to the chest, and the other one is this stretch. And most people naturally do this one or the one before as a form of relief. It just seems to take pressure off the disc. If these signs and symptoms are similar to what you have, you may have internal disc disruption. Thank you for listening.